Welcome to the Paint the Medical Picture podcast, a Nexen Pruet podcast series for best practice tips and insights for all your healthcare practices coding, billing, compliance, and reimbursement needs. I'm your host, Sonal Patel. Hello, and hope everyone is having a good day so far. Today is Wednesday, September 16th, 2020. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Welcome to my second episode number 2. I'm so happy you found me here, and I hope you're here because you understand that the patient's medical record, coding, and billing drive reimbursement. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss an episode. Please write in a review and rating on Apple Podcast or wherever you listen to my podcast. I'd really love your support. Now, a quick disclaimer. Before I get started on the episode, this podcast episode and podcast series do not constitute legal advice, but I am fortunate to work with sound healthcare attorneys at Nexen Pruet. And as their consultant, I have over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance and auditing for both E&M and surgical operative reports. Again, the opinions and insights throughout are mine alone, and they in no means constitute legal advice. All right, so let's get into some industry news in a segment I want to call Newsworthy. I wanted to go over the 10 new August 2020 updates made to the OIG Work Plan. Now, the money has certainly rolled out during this pandemic of COVID-19 to benefit our providers, their offices, their facilities, and their staff. But CMS and the OIG are now ripe for reviewing the delivery accuracy of those funds and so much more. So let's get started. The first update in the OIG Work Plan for August 2020 is for the audit of Medicare payments for inpatient discharges billed by hospitals for beneficiaries diagnosed with COVID-19. Section 3710 of the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act, directs our Secretary Azar to increase the weighting factor that would otherwise apply to the assigned diagnosis-related group, the DRG, by 20% for an individual who is diagnosed with COVID-19 and then later discharged during the COVID-19 public health emergency period, the PHE. So the OIG will audit whether payments made by Medicare for COVID-19 inpatient discharges billed by hospitals were actually in compliance with federal requirements. The findings from this audit are expected to be released in fiscal year 2022. The second update is for the audit of the CARES Act Provider Relief Funds, the PRF, both general and targeted distributions to hospitals. Now, the CARES Act and the Paycheck Protection Program, PPP, and the Healthcare Enhancement Act appropriated, as we all know now, $175 billion for the PRF to support our healthcare providers affected by the COVID-19 pandemic. Back in April 2020, the Health Resources and Services Administration, HRSA, began distributing the funds through general distributions to Medicare providers based on 2018 net patient revenue and targeted distributions for certain provider types. Those provider types are from areas particularly impacted by COVID-19, like our skilled nursing providers in SNFs, as well as providers in our more rural areas and not in the urban setting. Providers such as hospitals may be eligible for PRF payments from the general and targeted distributions. The OIG will select for audit a statistical sample of providers that received general and/or targeted distributions. Their overall objective is to determine whether providers that received the PRF payments complied with certain federal requirements, as well as the terms and conditions for reporting and spending those PRF funds. The results are expected to be reported in fiscal year 2021. Now, the third update in the OIG Work Plan is for the review and analysis on infection control and emergency preparedness at dialysis centers during the COVID-19 pandemic. Now, the Centers for Disease Control, the CDC, has stated that beneficiaries with serious underlying medical conditions, such as end-stage renal disease, ESRD, are at higher risk for severe illness from COVID-19. And of course, regardless of the current pandemic, our dialysis patients are at high risk for infection because of their already weakened immune systems, coexisting conditions such as diabetes, and their treatments that require frequent use of catheters or insertions of needles to access their bloodstreams. ESRD facility conditions for coverage regarding infection control and emergency preparedness are defined in 42 CFR 494 subpart B. Back in March 2020, March 30th to be specific, CMS issued a revised memorandum providing guidance for infection control and prevention of COVID-19 in dialysis facilities. The OIG will interview corporate officers from the 3 ESRD service companies covering more than 75% of calendar year 2018 Medicare reimbursements and 71% of dialysis clinics. Their overall objective is to determine whether ESRD facilities implemented additional infection control and emergency preparedness procedures in accordance with CMS and CDC guidance to safeguard these high-risk ESRD patients during the COVID-19 pandemic. This report is set to be released in fiscal year 2021. Now, the fourth update to the OIG Work Plan in August 2020 is for the audit of foundational cybersecurity controls for the U.S. Healthcare COVID-19 portal and protect.hhs.gov. So, both protect.hhs.gov and the U.S. Healthcare COVID-19 portal are critically important systems contributing to the federal pandemic response. The data collected by these systems are utilized in the response to COVID-19 by tracking the movement of the virus, by identifying potential stresses in the healthcare delivery system, as well as by providing information about the distribution of supplies, like our PPE. Without proper, effective cybersecurity, the integrity and availability of the data are at risk and can impact public health efforts. So the OIG will determine whether HHS has implemented foundational cybersecurity controls to ensure the integrity and availability of protect.hhs.gov and the U.S. Healthcare COVID-19 portal. This report is to be issued in fiscal year 2021. The fifth update is for the audit of the distribution of supplies from Indian Health Services, the IHS, their National Supply Service Center, in response to COVID-19. Now, our Native American Indians and Alaska Natives are particularly vulnerable to COVID-19 due to their relatively high rates of diabetes, cancer, heart disease, and asthma among these populations. IHS has received funding for medical supplies and equipment through the COVID-19 relief bills allocated to them. The objective of this audit is to determine whether IHS had adequate internal controls to ensure that medical supplies and equipment were effectively distributed to the National Supply Service Center's customers in response to the COVID-19 pandemic. Fiscal year 2021 is the expected time frame of the audit report's release. Now, moving on to the sixth update. It is for the accuracy of nursing home compare websites' reported health, fire, safety, and emergency preparedness deficiencies. Included in the website information are a nursing home's quality ratings, the results of recent health, fire, safety, and emergency preparedness inspections, as well as staffing levels and quality of care measures, and also penalties assessed by CMS. So the OIG will review the information reported on the Nursing Home Compare website and determine whether the information is in fact accurate and can be relied upon by consumers to compare and select nursing homes for their loved ones. The findings will be released in fiscal year 2021. Now, the seventh update to the OIG Work Plan for August 2020 is for rates of estimated payments from chart reviews and health risk assessments across our Medicare Advantage organizations, MAOs. Now, a previous OIG evaluation identified $6.7 billion in estimated 2017 risk-adjusted payments resulting from diagnoses that MAOs reported only on chart reviews and not actually found from nor on any records of services provided to beneficiaries in 2016. That's shocking. Findings from this evaluation raise concerns about the completeness of payment data that MAOs submit to CMS, the validity of the diagnoses on chart reviews, and the quality of care provided to our beneficiaries. A current OIG evaluation examines the extent to which diagnoses solely generated by our health risk assessments, the HRAs, were associated with higher risk scores and higher MA payments. The OIG will combine the data from these evaluations to perform new analyses that will then determine whether certain MAOs and parent organizations had higher or lower amounts of risk-adjusted payments from both chart reviews and HRAs relative to their peers. This huge report, in my opinion, is expected to be released in fiscal year 2021. The eighth update is for the audit of the Assistant Secretary for Preparedness and Response, the ASPR, Biomedical Advanced Research and Development Authorities, the BARDA, awarding of research and development contracts for fiscal year 2017 through fiscal year 2020. The OIG will determine whether ASPR complied with federal requirements when awarding contracts with BARDA for fiscal year 2017 through fiscal year 2020 appropriations. They will also determine if ASPR appropriately used the appointed research and development programs known as NEXT and DRIVE when awarding contracts. We should be seeing the audit results in fiscal year 2021. Now, the ninth update for the OIG work plan for August 2020 is for swing bed services at nationwide critical access hospitals, the CAHs. This audit will focus on review of swing bed data for calendar year 2015 through calendar year 2019 to determine whether, one, were any actions taken to reduce swing bed usage at CAHs, and also for number two, was Medicare payment amount updated for swing bed services to the CAHs? And number three, was alternative care available to patients at a potentially lower rate? The final report is expected in fiscal year 2021. And finally, our 10th update to the OIG Work Plan is for the audit of obligations and expenditures made from Biomedical Advanced Research and Development Authority for fiscal year 2018 and fiscal year 2019 appropriations. The OIG intends to audit the obligations and expenditures made from these appropriations to determine whether they were used for their intended purpose in accordance with federal requirements. The final report issue date is slated for fiscal year 2021. Wow. So, the OIG is intending for 9 out of these 10 reports to be issued in 2021. The OIG is clearly hard at work despite the status of the public health emergency and the chaos it has brought. Now, in my opinion, these reports with findings are always most interesting and informative, and I always look forward to analyzing them in the new years ahead. It's also important for my listeners to keep an eye on these monthly OIG Work Plan updates to see how they may impact you, your provider, or your health system. Do know, I plan on giving monthly OIG Work Plan updates to all of you. All right, and now it's time for my best practice tip in a segment I'd like to call Trusty Tip. When it comes to compliance with Medicare specifically, well, this trusty tip goes for the thousands of commercial carriers too. It is certainly without a doubt considered best practice to avoid any and all allegations of fraud, waste, and abuse. Best practice goes even further. Avoid violations of the False Claims Act, the FCA. Just a gentle reminder that June 2020 saw a new final rule that increases the civil penalties involved in FCA violations. This is the first increase since 2018, even though the Federal Civil Penalties Inflation Adjustment Act of 1990 requires an annual update. The minimum FCA penalty increased from $11,181 to $11,655 per each claim. The maximum FCA penalty increased from $22,363 to $23,331 per each claim. So, keeping this in mind, remember to review all coding and billing before claim submission to ensure correct coding, because these mistakes can be viewed as errors or result in larger abuse according to Medicare. And remember to ensure medical necessity is warranted for all diagnostic tests ordered, because these inefficiencies result in waste according to Medicare. And remember to avoid upcoding and downcoding of your evaluation and management, your E&M services, because these improper billing practices result in abuse according to Medicare. Also remember to avoid excessively charging for your services and supplies, because these improper billing practices result in abuse according to Medicare. Never ever bill for services or supplies that were not provided. These are intentional deceptions and will no doubt result in fraud. In my experience, other examples of improper claims include reporting a greater severity of illness than actually existed, or reporting more expensive treatments than were actually provided, or reporting for improper supervision or performance of a service by unqualified personnel, or the reporting and unbundling of services, and of course, improper claims with modifier abuses. or the misuse and misunderstanding of modifiers, as I discussed in episode 1. But by painting all the details of the medical picture, a provider's documentation will support the medical necessity for a certified medical coder to abstract codes with accuracy. And by painting all the fine details into the medical picture, providers will avoid these greater allegations of fraud, waste, and abuse. All right. And finally, this week's inspiring quote, in a segment I'd like to call Spark, is from Abraham Lincoln. You cannot escape the responsibility of tomorrow by evading it today. Profound. I think our 16th president's wise words still resonate with all of us in this space of healthcare. We have much work to do today if we want to meet the demands pressed upon us to provide integrity, quality, and value to the practice of medicine, as well as in the business of medicine. I am happy Honest Abe's spark still shines brightly in us today. So, that wraps up today's episode. I'd love to hear your questions and comments. You can always direct message me on LinkedIn or voice message me on the Anchor app. And if you'd like to inquire about my consultant services, you can always reach me through my email address at nexenpruet.com. I'll leave links to everything in the show notes below. Please continue staying safe and healthy. Practice safety for one and all during our collective life in the time of coronavirus. Hope you join me next Wednesday for episode 3 in the Paint the Medical Picture podcast series. Thank you for listening in on my second episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday. If you want more information from me, go ahead and follow me on LinkedIn or send me an email at sonalpatel@nexenpruet.com for all my consulting services in medical coding, auditing, and compliance. Thank you.